Karen Yanelli received her doctoral degree in physical therapy as well as a Bachelor of Science degree from New York Institute of Technology and owns a physical therapy practice in Manhattan. Since 2006, she has treated chronic neurological and rheumatological conditions such as all forms of myositis, rheumatoid arthritis, and lupus. Since 2009, while a physical therapist at HSS, she began working with leading rheumatologists to promote the role of physical therapy and wellness within their patient population. Annual presentations throughout NYC's autoimmune disease support groups are just one way Karen educates this underserved community. Please help me welcome Karen to today's workshop.
Hi, how's everybody doing? I hope good and didn't get caught in the rain. I'm very happy to be here to be speaking of exercise while living with lupus. I'm just going to go right into the presentation, and then at the end, I'll answer any of your questions. So if you have any notes or ability to take notes throughout the presentation and hold your questions for the end, I'll get to all of them. So to start the presentation, just next slide. Just a very clear reminder, you want to be medically cleared with your physician before you actively participate in any exercise program, whether it be with a physical therapist, an occupational therapist, or even a personal trainer. That's important to remember. Next slide. So what we're going to speak about is just an overview of the benefits of exercise in every person with or without lupus. People who exercise live longer with or without lupus. Regular exercise can reduce overall fatigue from lupus. Regular exercise improves functional ability in people with lupus. People who exercise feel better about themselves and are able to cope better with problems. Exercise can help to keep your bones strong. It can maintain muscle strength. Exercise improves sleep, helps control weight. Oh, next slide, please. Improves sleep, helps control weight, reduces risk of diabetes, reduces the risk of high blood pressure, helps prevent heart disease, lowers risk of stroke, reduces feelings of depression, and improves balance. And this is honestly just a short list of things that regular exercise can do. And more studies come out every year pertaining to the benefits. So how do we get exercising? Next slide, please. So I wanted to start with an overview of, in particular, aerobic exercise and the effects that aerobic exercise have on people with lupus. Next slide. So first study is dealing with how aerobic exercise programs affect the proteins in our blood that influence the immune system in people with lupus versus people without lupus. So on a side note, even back when I started working with an autoimmune population, a lot of physicians would tell their patients, don't exercise. You're going to fatigue yourself too much. You're not going to gain the strength back. It wasn't just with patients that were diagnosed with lupus. It was with patients that were diagnosed with myositis and rheumatoid arthritis as well, because the evidence wasn't very, very clear on what happens to a person with an overactive immune system when you do aerobic and cardio activity. So since then, it's been studied and highly proven that it's very beneficial. This is one of the studies proving it. So the name of the study, if you did want to read up on it yourself, is called Exercise Training Can Attenuate the Inflammatory Milieu in Women with Systemic Lupus Erythematosus. This is the authors, and the study assessed the effects of an exercise training program on cytokines in response to acute exercise in women with lupus versus women without. The study did a lot of outcome measures before and after a 12-week aerobic exercise training program. The cytokines, which we'll discuss in the next slide, were assessed before and after each exercise routine. So, next slide. What are these cytokines that are being tested so often in studies regarding people with autoimmune disease? So, a cytokine is a type of protein in our blood that is made by certain immune and some non immune cells. But most importantly, what you need to know is that they directly influence the immune system. So, some of these proteins stimulate the immune system, and some others slow it down. They are crucial in controlling the growth and activity of other immune system cells that are not cytokines and our blood cells in general. So, some examples you may have heard from your physician in the past or have been tested are interleukins or interferons. Now, the regulation of your immune system is very dependent on cytokines. So, cytokines that upregulate your immune system, if they're overly produced, your immune system becomes incredibly activated. And some cytokines that deregulate your immune system, decrease its effectiveness. If they're in abundance, then you have a low immune system. So you want a very fine balance. You want to respond to things that your body needs to fight off, but not so much that you become inflamed systemically. So that is what this study and a bunch of other studies are testing. Can your immune system regulate itself in the face of moderate cardio activity? Next slide. So this particular study showed that aerobic exercise training attenuated, so reduced the force of the inflammatory fluctuations and reactions in women with lupus. And this revealed the ability to maintain stability of the chemical agent, so stability of your immune system, or the cytokines, I should say, that modify the immune response during exercise, even with people with an autoimmune condition. So anyone, even without an autoimmune condition, will rev up their immune system and get it going with exercise. It's a normal response. That's why to actually, keep a strong immune system, a strong, healthy immune system in a normal immune population, people say regular exercise, regular exercise. You're less likely to catch viruses. You're less likely to catch bacterial infections because it really does rev it up. But lupus does not make your body go overboard to the point where now you're having flare-ups or increased symptoms. So it's important to recognize that. Next slide. So the next study, which is by the same authors, focuses on how does aerobic exercise affect the proteins that influence the immune system in people with active lupus versus people with inactive lupus. So the last study focused on lupus diagnosis, no lupus diagnosis. Now this study is focusing on active lupus, inactive lupus. So the aim of this study was to evaluate changes in certain cytokines in response to single bouts of acute, moderate, and intense exercise in women with active and inactive disease. Next slide. So the conclusion was that in this particular study, this study demonstrated both the single bouts of acute, moderate, and intense exercise induced mild and transient changes in cytokine levels in both groups of women with lupus. So according to this study, there is evidence that acute aerobic exercise does not trigger inflammation in patients with this disease actively or inactively. Next slide. And this is the last study that I wanted to reference and put out there for you to actually review on your own. This is a literature review study. So this study is looking at all of the literature that's been published over the past 10 to 20 years regarding exercise therapy in patients with inflammatory myopathies and systemic lupus. Next slide. So with this overview, the overview of literature is very, very selective on what studies are quote unquote good studies, significant studies, have enough evidence, have enough statistic numbers to become a good study. So out of all the studies that these people looked at, there was about a half a dozen that made the cut. So according to this literature review of multiple studies, they found by reviewing all these studies that moderate and high intensity aerobic exercise can improve aerobic capacity, which we would deem as endurance. And there's moderately strong evidence to back that up, and improve fatigue and depressive symptoms with limited evidence, but still significant, both without changing disease activity in patients with mild, inactive lupus and with low to no organ damage, because that was the inclusion criteria in a lot of studies that were reviewed. Okay, next slide. So, what is this recommended exercise? What is this regular exercise prescription that I keep quoting? With regular exercise, yada, yada, yada. So, regular exercise, according to the American College of Sports Medicine, Center for Disease Control, and basically any large medical organization, consists of 150 minutes of moderate intensity aerobic activity every week and 2 days a week of muscle strengthening activities on all major muscle groups. So, with cardio, you kind of get the gist. You have to break up 150 minutes within a 7-day week to perform the recommended amount of cardio. With strength training, to focus in on this, 2 times a week, all major muscle groups need to be exercised. Now, a lot of people don't have time to spend 40, 50, 60 minutes exercising their entire body twice a week. You may only be able to put 15 to 20 minutes of strength training in. So 15 to 20 minutes twice a week of the leg muscles, and 15 to 20 minutes twice a week of the core, back, and arm muscles may be the most functional way to get the 2 times per week on all major muscle groups. So those are the recommendations. Next slide. So to start physical therapy, what you want to ask is, you want to ask your medical doctor and your physical therapist, what exercise are recommended? How do I exercise? And then how often do I have to do these exercises? Those are the 2 most important questions that you need answered after you've been evaluated. Next slide. So, specifically from a physical therapist, you should expect, upon evaluation, education on your condition, testing of impairments and all functional limitations. You should go through everything from bed mobility to gait impairments to stair climbing to dressing to any functional task that you may or may not be having any issues with. Then you're going to set expectations and a prognosis in combination with the therapist, and you're going to list obtainable goals and a time frame that you'd like to obtain these goals in realistically. Next slide. So, types of exercise that you should expect to be prescribed are aerobic, which we discussed in detail being very, very important. So when I evaluate a patient with any autoimmune condition, I hone in on, what are you doing for aerobic activity? What do you consider aerobic activity? Because some people say, oh, I walk a lot throughout the city. Well, is your heart rate elevating this much? Do you feel exertion at a moderate level? If not, then that's not aerobic activity. And really educating patients on what is considered aerobic. And then how do you access the modes of aerobic activity? Do you have access to a gym? Do you have equipment in your apartment or home? Next type of exercise, non-aerobic. And so non-aerobic just means that you're not going to demand as much oxygen from your body to perform these exercises. So you could think of these as strength training. And then there's the combo, aerobic plus non-aerobic. So you might have heard of like high intensity interval training, where you're doing a little bit of aerobic and then stopping that and doing non-aerobic, but your heart rate's continuing to be elevated because you just stopped the aerobic activity. You're doing a couple of minutes of weight training, then you're going back to the aerobic activity to boost your heart rate more. That's interval training. And then the last type of exercise to discuss is basic range of motion stretching, and gentle conservative exercises like isometric contractions that you can do even during a flare. Next slide. So just to reiterate again, the exercise prescription for aerobic exercise is 30 minutes a day, 5 to 7 days a week, which would equal the minimum minutes of 150 on a weekly basis. Next slide. This can be done in many different ways and does not have to be done in one set time frame. So for instance, if somebody has 15 minutes before work and 15 minutes after work that they can carve out for cardio, that's 30 minutes in one day. It does not have to be done in one sitting. And in fact, many patients after a flare up or newly diagnosed, they can't do more than 10 minutes of cardio. So you build up to what your tolerance is. Some modes of aerobic activity that I highly recommend are aquatics. I love that because it's not compressive. Cycling. And for some motivation, every once in a while, you can throw in a dance class there. One of those group classes in the gym is always fun and motivational. Next slide. So equipment-based exercise is the easiest for any patient of mine to perform because you can go to the gym at any time. You don't have to hit a class. You don't have to sign up for the pool. You don't have to, you could have a bike in your home. You don't have to leave your house at all. So treadmill is very popular, although I really do not recommend it to my patients due to secondary effects of prolonged joint compression and risk of injury. So I always say stationary bike and elliptical are my two favorite equipment-based exercise modes to recommend. And then if somebody is having difficulty going to the gym, setting up a bike in their house, and they want a small piece of equipment, the arm bikes that are available on Amazon or any of these warehouse kind of websites, you can use that as cardio. It's just much more difficult. Reason is the arteries in your upper extremity are just smaller due to the nature of the size of your arms, and you will have to pump harder to make sure that the blood can go back to your heart to make sure that you're getting enough oxygen throughout your body. So it's basically like quick return, faster return, a lot of load on your heart because these arteries are small and they're just pumping back really fast. And it's hard to do 30 minutes on the arm bike. Next slide. So non-aerobic exercise prescriptions are very important, and you would call them strength training. Modes of strength training include basic free weights, hand strengthening with using a putty or a gripper, functional exercises done multiple times, going to a gym and using the circuits, the weight machines, leg press, row machine, a cable column. And then, of course, you can use something as simple as a TheraBand for resistance. Next slide. So circuit training is the combination that it's basically like interval training. It's the combination of aerobic and non-aerobic exercise. So like I was saying before, you're alternating strength training and cardiovascular training in an effort to sustain an elevated heart rate for both modes of activity. So for instance, a very popular mode is like going on the treadmill for 10 minutes and then moving directly to quadricep and glute strengthening for 2 minutes, and then getting back on a bike, another mode of cardio activity for 10 minutes, and then doing more leg strengthening for 2 minutes. So you get your strength and cardio very close together. It is considered aerobic the entire time because your heart rate is elevated the entire time, and then also non-aerobic because you're using muscles, again, resistive exercise against muscles for strength training. Next slide. So I want to just talk about just basic range of motion, stretching, isometric exercises, and different types of less strenuous activity for the days where you're just exhausted, more exhausted than usual, for days that you're having a little bit more pain than usual, a little bit more soreness. And for days that you just want to just decompress. And one of the best things that I've seen is meditation while stretching, modified yoga, Tai Chi, slow dynamic warm-ups to activities. So if you just want to go for a walk, literally you're going to march in place slowly before you start to actually dynamically move forward. And then different stretches for individual muscles that you would hold anywhere between 2 to 10 seconds at a time. Make sure you have a program for days that you can't complete the cardio and strength training you want to, but you absolutely don't want to remain sedentary. Make sure that your therapist gives you, a take-home worksheet with these types of activities. Next slide. Okay, so I want to focus on, just gonna take a sip of water. I want to focus on pain. So a lot of people ask me, how do I know if the soreness that I'm feeling the day or 2 days or even 3 days after I exercise is normal? So I want to focus on, when is pain with exercise not normal? Number one, if you're having moderate to high intensity pain, don't exercise, don't strength train. You could do mild aerobic activity. Like, you may feel better just kind of going on a bike with no resistance and trying 5 minutes to loosen up your legs if you're feeling achy. But you don't want to perform a full exercise prescription if you're having moderate to significant pain, which is 5 to 6 is considered moderate pain, and then anything 7 to 10 is a no-go. So say you're experiencing your normal pain level, say you're uncomfortable, you're 2, 3, 4, 10, and you want to try exercising. If your pain remains the same while you exercise, that's normal. It's not increasing. Hopefully it decreases. And in most cases, my patients do say they feel better while they're exercising or right after. But if it increases, stop. So any unfamiliar pain during exercise, stop. Pain that's regular for you, that you felt before you started activity, continue. And then say you had very mild pain before you exercise, and then the next day you wake up and you're like, oh my gosh, I can't even, kick my legs out of the side of the bed. My thighs are so sore. If that lasts 2 to 3 days and gets easier after the second day, and the third day it's pretty mild and then it goes away, that's normal. That's called delayed onset muscle soreness, and we should all be expected to have that at certain points, especially when you just start an exercise program and when you just increase your resistance of an exercise program. Anything that lasts more than a few days, no good. That's when you have to modify your exercise program. So just to review, no strength training, no significant cardio activity if you're having pain that's greater than a 6. If your pain elevates or begins while you're exercising, stop, tell your therapist. And if you have muscle soreness that began the day after exercise and lasted for more than 3 days, tell your therapist, because it just means you do need modifications in your program. Next slide. So I also like to, while people are working out, focus on breathing techniques and just a little bit of an overview. So diaphragmatic breathing is when all of your air is inhaled through your belly, right? So you're breathing it in through your nose, it's going down your throat, and instead of elevating your shoulders and your chest, your belly is expanding. Your diaphragm is expanding. That is the most efficient way to breathe. We are made to diaphragmatically breathe. That's why you see babies breathing 100% properly. They use their diaphragm. That's the most efficient way for our body to receive oxygen. So while you're exercising, try to focus on breathing as well through the diaphragm. Some kinds of relaxation, if you're feeling achy or extra stressed, is joint approximation. So for you, that would just be getting up and stand, leaning on your arms a little bit, putting a little bit of weight through your joints, as long as it doesn't cause pain, actually has a reflexive message to our neurological system to relax the muscles around it. Same thing if you want to just even push on your joint and kind of like rub it, same thing. That joint approximation, that tight feeling can let you relax easier. And then slow movements. So doing exercises in the proper timing. A lot of people just want to get through their exercises and they're 1, 2, 1, 2, 1. But really hold two and release. Slow movements will help you not only to recruit more muscle fibers and get better strengthening, but also it will help you to not tense up other muscles in your body while you're exercising. Next slide. And then I want to talk about balance training with you. Side note, there has been a ton of studies on what decreases risk of falls. Now, with balance training, the main goal is to decrease risk of falls. Any outcome measures pertaining to balance solely deals with risk of falling. So, what is the best way to train your balance and decrease risk of falls? Cardio activity. I swear it does everything. So if you're doing your cardio, you are checking the box for balance training. But if you want to feel more connected to the ground, more sturdy, you could do posture awareness training, sensory training, where you're using your vision and looking in a mirror as you're performing functional activities to improve your body mechanics and your postural awareness. And task specific performance training, doing something that you feel unstable doing over and over and over again to increase that pathway from the brain to the muscles so that you have more confidence. Next slide, please. So one of the easiest ways to test your balance is to do something called the single leg stance test. So if you're with someone, they would be standing close to you in case you lost your balance. It's hard to really fall, because if you feel like you're losing balance, just put the other leg down. But if you're home and you're alone, go next to a stable surface. Kitchen counter, I love. So you're standing next to the kitchen counter. Your hands are on the counter. You have a timer in front of you. And you stand on one leg. And when you're ready, you let go of the counter. This slide shows you the normative values for each age group. Ideally, I would like my patients to get 10 plus seconds of a single leg stance, but anyone that's over 70, the normative value is 4 seconds. And this, again, is a test for fall risk. If you're unable to stand on one leg for less than 4 seconds, for more than 4 seconds, your risk of falling is higher. So that may make you think, maybe I should use the cane outside. Maybe I should get that elevated toilet seat that I've been thinking about. Maybe I should only sit in chairs that have armrests to help me push up. So just an outcome measure that you can do on your own. Next slide. Okay, so now that we did a bunch of overview on exercise, I want to go through basic mobility exercises. And that was one of the slides I talked about, just like stretching and maintaining posture. And these are not going to be anything that you would do for any strengthening per se, but just for postural awareness, elongation of spine, and to make sure that your body mechanics throughout the day are as centered as possible. So the first exercise that I want to review with you are neck retractions. Now, this exercise can be done every hour. It's basic postural realignment using your deep neck flexors, and every 2 to 3 hours, it's almost like a must, but every hour you can do it. What you're going to do, and I'm going to turn sideways, and I literally can't see myself, so I hope I'm on camera. Just let me know if you can't see me. Your ears should be over your shoulders. Chest is upright. You're going to place 2 fingers on your chin and you're going to tuck your chin halfway in. After you perform a chin tuck, you're going to push and release. Push and release. So just to show you from the forward view, you're literally making a double or triple chin if you can. So chin tuck halfway, push the chin into your neck, chest comes forward, and relax. What this exercise is doing is realigning your head, shoulder, and thoracic spine posture. And that's going to help prevent neck strains, headaches, shoulder issues. I mean, a lot of secondary orthopedic conditions that develop from poor posture. The next stretch is rotation. So after you've performed just about 10 of these retractions, and again, it's just a 2-second hold. This stretch will take you 30 seconds. After you perform 10 of them, you're going to look to one side and you're going to look to the other. Your ears should be over your shoulders. They should not be hiked up. Your shoulders should be depressed. And you have that half chin tuck, and you're just going to look side to side. You can use your fingers to guide your head. And you're just going to perform that 5 times in either direction. So this is really good for the upper cervical spine and to loosen up any tight muscles at the base of the skull. Okay, next slide, please. Next, going down the chain is your thoracic spine. So we touched upon the cervical spine, upper cervical and lower. Now we're going to go through thoracic. Now, thoracic spine is from the top of your rib cage to the bottom of your rib cage. It has or should have the most mobility out of any portion of the spine. It flexes, extends, side bends, and rotates. And what we're going to do is rotation. So what I want you to do is just depress your shoulders. Your neck should be nice aligned, your ears over your shoulders. You're going to clasp your hands. If you're comfortable with that, you could clasp with fingers, you could hold, even hold the elbows. You just want your arms in front of you, basically. And what you're going to do is you're going to look and twist to one side, and you're going to look and twist to the other side. And this is just very gently moving your thoracic spine. If you felt, and this would be rare, if you felt any kind of shooting or stabbing pain with this or any of these stretches, you would stop. But it is very rare, thank goodness, to have any nerve compression in the thoracic area. So after you do that 10 times, next slide, please. You'll then move down to your lumbar spine. So this area of the spine is typically the area that we slouch the most because we sit with a slouched posture, and our lumbar spine, being the base of our whole trunk, is the first piece to just rotate backwards. And what happens is your pelvis rolls backwards posteriorly. That causes all the ligaments to stretch out in your lower back. And that can give you that stiff, achy feeling. But on another note, there is a lot of cases of nerve compression in this region. So again, if you're doing this stretch and you have any kind of like shooting, stabbing, any kind of tingling, numbness, anything at all that doesn't feel like a normal stretch, don't do it. So basically, I can't see myself, but I'm going to move this back. Christine, if you could just give me a thumbs up if you can see me. You can. Okay, good. What you want to do with this stretch, put your hands on your lower back. You're then, without looking up, your face is going to look forward. You're going to stretch back and come center. And you're going to go further as long as you're comfortable each time you perform this. And a lot of people want to throw their neck back. Don't do that. Just let it be a lower back stretch. Keep your face forward. So you're going to do that 10 times. And I recommend to do this stretch at least 3 times a day. But just like cervical retraction, you could do it every hour. And especially if you're sitting for a long period of time, you can absolutely do this as soon as you stand up. Okay, next slide. All right, the next two exercises, I won't even demonstrate because I feel like you won't see my legs, but they are for ankle mobility and knee mobility. So again, you need to be near a stable surface, preferably the kitchen counter, kitchen sink, bathroom counter, bathroom sink, something that is literally grounded, not like the chair in these pictures, but for some reason, that's all these programs use as a prop, as a chair. You're going to do heel raises. If you cannot do heel raises because weight bearing is painful, then just do ankle pumps. Pump your ankles up and down because you want to maintain ankle mobility and it's good for circulation. Next thing on the right side of the slide is hamstring curls. This is when you're standing at the kitchen counter and you're kicking your butt, you're bending your knee, and you're alternating side to side. The heel raises, or if you're unable to do heel raises, the ankle pumps should be done 20 times. And the knee flexion should be done 10 times. And again, a few times a day at least. Keep the joints moving. This is all gentle. It will not count as strengthening, but it also has a lot of benefits in itself. It's more like let's prevent pain, let's prevent injury. These types of exercises will help with that. And next slide, please. After you're done with your physical therapy program, what do you do? Okay, number one, you can join a gym. That's what most patients do. Either they get equipment in their own apartment, they join the gym in their own apartment, or they join a community gym. Some people join a wellness program that's within a therapy center, and they are observed by a therapist or assistants while doing their own independent exercise. Some people sign up for exercise classes, whether they be on Zoom, in a gym. They think that group motivation is what they need. Great. And then sometimes people just continue the strength training at home. They'll do different types of cardio, watching YouTube videos and jazzercise. I have patients doing sometimes. And these are the most popular ways to continue your exercise. Next slide, please. If you don't know where your nearest community center gym is, I highly recommend going online to the New York City governmentparks.org. You're going to look up where the city recreation centers are. You don't have to go, if you live in one borough, you don't only go to that borough. You can go to any of the counties as long as you're a New York City resident and use all of the recreation centers. It's very, very low cost. These prices are from like 6 or 7 years ago, but it was like $150 a year. And that's probably the cheapest gym you're going to find. I know some of my patients do Planet Fitness. That's $10 a month. That might even be cheaper. So there is affordable recreation centers and gyms in the city. Next slide. This is my email address. So if you have any questions that I don't reach in our next 15-minute portion of the presentation and you want to ask me, just shoot me an email. And thank you so much for your time.
So much, Karen. I really appreciated also all of the demonstrations of the different exercises that you were talking about. And don't worry, you were in frame for all of them, which was great.
Oh, literally just staring at the PowerPoint, so I'm not sure.
I didn't realize that you weren't able to see yourself because you're on your phone. So of course.
Oh no, PowerPoint.
All right. So if anyone had any questions for Karen, we have until 1 p.m. If anyone wants to come